Thank you for allowing me to share the Kansas Community Health Worker Certification policy and process. It was developed as a joint effort with the Kansas Community Health Worker Coalition, Wichita State University, Kansas Department of Health and Environment, the Kansas City Regional Community Health Worker Collaborative, the Mid-America Regional Council, and many more strategic partners. Before we jump into the policy and the process for applying, I want to make sure that you are clear on the differences between a certificate program and a professional certification. A certificate program is an education program that the learner is enrolled in and completes an educational process. It is often provided by an institution or an organization that focuses on education. The Kansas Community Health Worker Coalition is an educational provider. The Metropolitan Community College and the Kansas State University are examples of educational institutions. Each learner will complete the requirements of the course. The learner can be anyone from newcomers to a profession to people who are more experienced with the work. At the end of the certificate program, the learner will receive a certificate of completion. The difference is that a professional certification shows that an individual meets a standard level of professional experience, has a mastery of a set of skills, and shows competencies to complete certain job duties. Sometimes there's an assessment or exam that the professionals have to complete in order to become certified. There is no exam required for community health workers in Kansas. The organization that manages the CHW certification process is the Kansas Community Health Worker Coalition. Now I'm going to go through the requirements for the certification as outlined by the policy, and then we'll touch on the application process. After a CHW applies and receives their certification in Kansas, they must reapply or recertify every 2 years. There is no background check that is required for the application. The Kansas CHW Coalition has decided that it is the employer or volunteer organization's responsibility to complete background checks if they require this. The coalition recently eliminated the high school diploma or equivalent requirement. They are working to make the application process more equitable for everyone. Applicants do not need to be a Kansas resident, and they must be age 15 or older. The application fees are $45 for the initial submission and $45 every 2 years when recertification is due. However, thanks to the Kansas Department of Health and Environment, the application fees are waived through the end of August of 2024. When a CHW receives their certification document, they will also receive a continuing education manual that outlines how they must earn at least 20 continuing education units every 2 years. These CEUs must align with the Kansas CHW scope of practice. As part of the 20 hours, 6 hours must be completed with ethics and HIPAA training. This is a total of 6 hours of ethics and HIPAA training combined. In addition, no more than 10 hours can be counted toward one core competency area. CHWs can earn all CEUs from the Kansas Community Health Worker Coalition, the Mid-America Regional Council, and other partners for free. The coalition also accepts certificates from other trainings that CHWs complete. 1 contact hour is equal to 1 credit hour. Kansas also accepts applicants through the work pathway. A CHW can document 800 hours of paid or volunteer experience over the course of 3 years. This pathway will not sunset, meaning that the work pathway will be maintained. The Kansas Community Health Worker Coalition has a certification task force that serves as the advisory group for certification. In addition to the work pathway and the education pathway, Kansas also accepts Missouri CHW credential as a third pathway. The coalition is also reviewing other states' certifications and credentials for future consideration and encourages applicants to contact us if they are certified in another state. Once the CHW is certified in Kansas, they will be placed on the coalition website registry. This only includes name, certification number, dates of certification, and no additional protected information is included. So now we are going to go through the certification process. This is where the CHW needs to go to apply for certification. When an applicant goes to the website, this is what it looks like. This yellow box will be at the bottom, and as you scroll down, you will see these blue and gray boxes. We'll walk through each pathway's requirements here. If a CHW completes a CHW course that is recognized by the Kansas Department of Health and Environment, they will receive a certificate of completion. That is the only document that needs to be submitted when applying through the education pathway. The applicant must also fill out the questions on the application and sign the Code of Ethics form. If an applicant applies through the work experience pathway, there are a few more documents to gather. A new requirement is a letter from the employer or volunteer agency verifying the 800 hours over the course of 3 years. In addition, we ask for 3 letters of recommendation and a self-reported competency worksheet. There are templates available on the application for the letters of recommendation and the competency worksheet. Just like the education pathway, the applicants through the work experience pathway must also complete the application and sign stating that they agree with the CHW Code of Ethics. Now moving on to the reciprocity pathway. The only documentation required is the certification document or card from the Missouri Credentialing Board. And again, the completion of the application and a signature of the agreement with the Code of Ethics. If you scroll down on the website, you'll see the Apply Now button. The applicant can click and fill in the online application. The button for the downloadable application may be missing. We are updating the document and it will be reactivated soon. If the applicant does see the button and clicks on it, the application will download and it can be printed or filled in on your computer. We do accept mailed applications. If there is no button for the downloadable application, you can request a copy with me through my email. So you might be asking yourself, why do I need to become certified? The CHW profession gains more recognition and respect among both medical and non-medical professions with a certification. Many other professions understand that a certification shows competency to complete a certain standard of work. CHWs often have increased confidence in their individual work, and there are more professional opportunities for growth if you are certified. And now there is Medicaid reimbursement available for CHWs who work for organizations that can bill CanCare for their job duties. This offers more financial sustainability for the CHW profession. In review, if you are part of a certificate program, you will receive a certificate of completion at the end of your course. CHWs must apply after completing their course to receive their certification. There are 3 pathways for applicants: the education pathway, the work experience pathway, and the reciprocity pathway with Missouri credentialed CHWs. If you are just completing your CHW course, make sure that you submit your application within 6 months of completion. My contact email is alyssa.rankin@wichita.edu, and please don't hesitate to reach out if you have any questions or need any assistance with your certification application. Thank you.